Backpacks and school supplies aren't the only thing parents need to make sure they check off their back-to-school list.
And the Michigan Health Department is now saying that child vaccination rates are the lowest in more than a decade. News Channel 3's Autumn Pitcher joining us live in the studio to find out what parents need to know about this developing crisis in the classroom. Autumn?
Yes, Andy, Jessica, children are required to have routine immunizations for diseases like measles and chickenpox to be able to attend public schools here in Michigan. However, the Kalamazoo County Health Department tells me an alarming number of kids don't. Less than 7 out of 10 kids between 19 and 36 months are up to date on their shots. And the Michigan Care Improvement Registry says that's the case in more than half the counties statewide.
I'm worried about, the parent making their own decision on what they feel best for their child.
We were a little scared with the COVID vaccine. We were a little hesitant at first just because it is a newer vaccine.
Maria Allen's 10-year-old son Holden has a rare heart condition, so she doesn't think twice before making sure he's caught up.
But it was very scary. He was failure to thrive. He was in the lowest percentile up to about a year of age. He wouldn't be here today if he didn't have some of those vaccines.
The Kalamazoo County Health Department says immunization levels for children between 19 and 36 months is down 5% from the last year.
It's concerning because you need a certain amount of threshold for each different illness.
The health department's clinical services supervisor, Nicole Wilson, believes there could be a measles outbreak if numbers don't improve.
One case of measles in a susceptible population, so that's people who haven't been vaccinated, can infect 12 to 18 people.
It's why Wilson says it's all hands on deck at the health department as kids head back to class.
They're in a congregate setting, so they're close to each other, they touch each other. So if we can prevent an illness from occurring, that's what vaccine preventable diseases do.
Behind me here are vaccine requirements for children to be able to attend public schools here in Michigan. We will have this full list on our website, WWMT.com. Now, parents can submit waivers for unique circumstances, such as a child's medical condition or religion. The Kalamazoo County Health Department also offers walk-in clinics Monday through Friday.
Sticker shock. New tonight, many of you are paying more for gas. In fact, prices across the area now close to $4 a gallon for regular.
You likely noticed that's because in most spots that is 16 cents higher in Michigan, 15 cents higher in Indiana than it was just a week ago. WSBT 22's Erica Finke joins us live in Mishawaka. And Erica, we're more than 35 cents higher than this point 1 month ago.
And those experts I spoke with say that gas prices typically follow a cycle where it goes up in the summer because people are traveling and then down in the winter. But these experts say it's not following that typical cycle because of factors outside of our control.
We are at that level today at 386. It's the highest the national average has been since last October.
Your wallet might be feeling it as gas prices have increased toward the end of the summer. Patrick DeHaan with Gas Buddy says that's rare, but there are extenuating circumstances pushing the price closer to the $4 mark.
The price of oil has gone up for 7 straight weeks. That's part of the reason why in mid-July we suddenly started seeing gas prices go up. That has to do with the decision that Saudi Arabia made in June to cut oil production by 1 million barrels a day.
DeHaan says the Whiting, Indiana refinery pushed up its maintenance by several weeks, and Molly Hart with AAA says nationwide weather is also to blame.
And with that hot weather, it causes problems with the refineries and not being able to have all the right equipment working properly, and that can raise the price of gas.
DeHaan believes prices at the pump could start to drop before Labor Day. Even if they don't, Hart believes it will not impact the amount of travel we'll see that holiday weekend.
But what they're going to do is make different changes. They might not eat out as often and go to a less expensive restaurant. They might also stay at a less expensive hotel. So they're still eager to travel. They're just budgeting differently.
While DeHaan believes there is some relief in the near future, he says that could change depending on if a hurricane hits the U.S. or if Saudi Arabia continues to cut oil production.